Hi, I'm John Fuller, Director of Virginia United Methodist Pensions, which is also known as VUMPI. VUMPI is the Virginia Conference's agency that administers the denominational pension plans and clergy benefit plans for clergy of the Virginia Conference. In early 2024, I co-led a conference task force along with Reverend Jesse Colwell, the Director in the Center for Clergy Excellence, and David Domesey, the conference's CFO and Treasurer. This task force, called the Clergy Benefits Task Force, included representation from a broad spectrum of Virginia Conference leadership and was formed to enable a cross-functional review of several aspects of our conference's clergy benefit programs. The task force met throughout 2024, and at the end of last year, several recommendations were released. One recommendation has already been adopted and was announced to the Virginia Conference earlier this year. That recommendation was to replace the active clergy health plan apportionment with a new monthly direct bill structure in 2026. A video describing that change can be found on the News and Updates section of the Virginia Conference's website. The task force also presented several other recommendations to the VUMPI Board of Directors. Following review and discernment, VUMPI will be presenting several recommendations for annual conference approval that are based on the task force's initial recommendations. In order to help prepare for this year's annual conference, we wanted to share some details of the recommendations that emerged from the task force's work. One recommendation pertains to the conference-sponsored retiree medical program for Medicare-eligible retired clergy. The task force reviewed a program called VIA Benefits, which has partnered with Westpath, our denomination's pension agency. Currently, 28 other annual conferences have adopted the VIA Benefits program for their Medicare-eligible retirees. VUMPI is recommending that the Virginia Conference adopt this program for clergy retiring in or after 2026. More information will be shared about the VIA Benefits program in a separate video, but the general intent of adopting the program is to provide greater plan choice to our conference's retirees while retaining the same value of the benefit. Also, I'd like to note that no current retirees will be required to change from their current retiree health benefits. While current retirees will have the option to move to the VIA Benefits program, they will also have the option to remain in the current plan administered through United Healthcare. VUMPI will also be presenting two recommendations that came out of the task force pertaining to retired clergy who withdraw from the United Methodist Church after 2025. Specifically, the recommendations are to terminate retiree health plan eligibility along with eligibility for the Virginia Conference-sponsored retiree life insurance benefit for any retired clergy who withdraw from the UMC after the end of 2025. I want to stress that this is absolutely not intended to be punitive in any way. These recommendations are based on the discovery of several administrative challenges associated with the termination of conference-level access to personnel records at Westpath for clergy who withdraw from the UMC. I also want to stress that this is not a retroactive recommendation. Any clergy who have withdrawn from the UMC prior to the end of 2025 would not lose their retiree medical or supplemental life insurance benefits. As you're likely aware, United Methodist churches previously had the opportunity to disaffiliate from the UMC under a specific provision in the Book of Discipline. While that provision was in effect, several Virginia Conference retired clergy elected to withdraw from the UMC due to personal theological beliefs. That provision of the Book of Discipline expired at the end of 2023. The task force's recommendation is based on a belief that a retiree's opportunity to withdraw from the UMC while retaining full benefits can also be similarly time-bound, with that opportunity ending at the end of this calendar year. My expectation is that retired clergy who felt compelled to withdraw from the UMC due to theological concerns associated with human sexuality have likely already done so. If that is accurate, these recommendations may not impact any Virginia Conference retirees' benefits. However, due to the administrative concerns that have been identified over the past couple of years, VUMPI believes it is important to present these recommendations for annual conference approval. One other recommendation related to clergy benefits was developed by the task force and will be presented by VUMPI for annual conference approval this year. Currently, VUMPI administers a health plan that is only made available to clergy receiving disability benefits and surviving spouses and children of clergy. Because of the restrictive eligibility rules, there are relatively few members enrolled in this plan. VUMPI has learned that the process of transitioning members between the plans for active clergy and this plan often results in adverse member impact. While the plan was intended to be a slightly more generous plan design, it often actually results in an increase in a plan member's financial liability. In order to simplify the plans and to eliminate the potential for adverse financial impact to plan members, VUMPI is recommending that the PPO 500 plan be closed to new members beginning in January of 2026. Current plan members will be able to remain in the plan, but no new enrollment will be added to the plan after the end of 2025. Clergy who gain eligibility for disability benefits and new surviving spouses and children of clergy will be able to remain enrolled in the same plans made available to active clergy at active clergy rates. Finally, a question that was received during last year's annual conference was referred to the task force for consideration. That question involved the potential to extend conference health plan eligibility to clergy serving 75% appointments. Currently, only clergy serving full-time are eligible to enroll in the conference-sponsored health plan. Following a detailed review, including the consideration of multiple potential funding strategies, along with other non-financial dynamics associated with health plan eligibility guidelines, the task force recommended that the current health plan eligibility guidelines remain in place, with clergy serving less than full-time remaining ineligible to enroll in the conference-sponsored health plans. If you have any questions about the work of the task force or any of these recommendations, please don't hesitate to call me or email me at 804-521-1128 or at johnfuller@vaumc.org.